You're listening to Puma Podcast.
Hi, you're listening to Teka Teka News, powered by Puma Podcast. In this episode,
Nagkaroon tayo ng emerging infectious disease. Ito, re-emerging. Nag-re-emerge siya. Pertussis, wala na kami nakikita nito. In fact, yung mga
I have
bata...
not heard this in a long time
I
until
know.
now.
we explore why pertussis and other vaccine-preventable diseases are making a comeback in the Philippines. If you know a child who's been coughing like that, they may need to get checked. What you just heard is an example of whooping cough, which is also called pertussis. It starts as a mild cough and cold that lasts for a few weeks, but then it turns into fits of coughing with that characteristic whooping sound. The whooping cough can last for up to 6 weeks. Pertussis is a bacterial infection, so doctors often prescribe antibiotic treatment that can last up to 2 weeks.
Si Aling Annalyn, residente ng Quezon City, tinanong ko kung nabalitaan na ba niya ang sakit na pertussis o whooping cough.
Ko alam yan.
Bakit?
Kasi po wala kaming TV kaya hindi ko alam yan.
Ganon din si Princess, tila walang ideya tungkol sa sakit.
Wala po kasing nag-a-announce po dito nun sa lugar po namin. Kaya hindi po namin alam yung about po sa sakit po na yun.
Pertussis may sound like a new illness to some, but it's nothing new. Outbreaks of the disease were first recorded as early as the 16th century. But in 1914, a vaccine against pertussis was developed. And in the 40s, it was then combined with vaccines for tetanus and diphtheria to become the DTP vaccine we know today. In 1976, the DTP vaccine was included in the Philippines' routine vaccinations under the expanded program on immunization.
Ngayon yung pertussis, binibigay yon as early as 6 weeks yung baby at 2 beses pa muli ibibigay yon 1 month apart. At ang bakunang ginagamit dito sa atin ay pentavalent 5-in-1. Ngayon marami nagtatanong sa amin kung paano yung wala na sa edad na yan, paano silang mabibigyan. Ito lamang po ang mabibigyan ng 5-in-1 sapagkat sa older children, ibang klaseng bakuna po yung binibigay.
That was epidemiologist Dr. Eric Dayag. He recently retired from his post as Health Department spokesperson. The pentavalent vaccine he mentions doesn't just protect children from pertussis. It also provides immunity against tetanus, hepatitis B, diphtheria, and influenza type B, all of which are vaccine-preventable diseases. After the first 3 master doses, beginning at 6 weeks old, children 1 to 6 years old may receive a booster. It takes around 6 weeks for the vaccine to create the antibodies needed to combat the diseases covered by the jabs. Now 47 years since the country's immunization program was established, vaccine-preventable diseases are now making a comeback.
Pinigting pa ng Department of Health ang bakunahan ito sa laban sa mga sakit na tuspirina at tigdas. Ito'y dahil sa pagtaas ng mga kaso nito tulad na lamang sa Quezon City na nagdeklara na ng outbreak sa tuspirina.
The spike in pertussis cases can be traced all the way back to 2023, when the Department of Health logged 742 cases nationwide from January to December last year. That's 15 times more pertussis cases compared to 2022, when the DOH logged just 42 cases. And this year, the Philippines recorded 1,142 pertussis cases in the first quarter alone. Around 70% of patients are children under 5, and around 6 out of 10 of these children were not vaccinated for the disease, or their vaccination status is unknown. Health Secretary Ted Herbosa says vaccine hesitancy is to blame.
Part of it to blame of the hesitancy is social media. Kasi ang nakita namin, science is being fought by pseudoscience. So itong mga bakunan to, siyempre may bagong bakuna, yung COVID, matandi yung doubt doon. Pero yung mga measles vaccine, diphtheria, pertussis, tetanus, proven vaccine since the 1960s. 1963 to implement, 70s it became a program in all countries, and almost na-eradicate natin ang polio sa Pilipinas dahil sa vaccine.
We're pausing for a quick break, but when we come back, let's discuss whether Pertussis' comeback can be attributed to vaccine hesitancy alone.
Former Health Secretary Janet Garin and several other people face formal criminal charges over the alleged Dengvaxia vaccine-related deaths. Department of Justice.
The 2016 Dengvaxia controversy surrounding an anti-dengue vaccine that was distributed to school children was part of the problem. In November 2017, Dengvaxia's manufacturer, Sanofi, updated its advice on the vaccine, saying the jab could cause more severe dengue in children who never contracted the disease. This means the vaccine is best for children who have previously had dengue already. It's worth noting Sanofi's definition of severe dengue had milder symptoms than international standards, but by then, the damage was done. To this day, vaccine hesitancy is still a huge problem in the Philippines, and trust in vaccines is yet to be restored through information campaigns and communication plans from the government's end. The DOH aims to vaccinate around 95% of Filipino children against diseases such as pertussis. But a study from the Philippine Institute for Development Studies, or PIDS, found that they never met this target.
Ito ay nangyari because of many years of bumababa yung vaccination rate natin. And ang nasisingan ng World Health Organization, nung tinignan nila to, ay yung fact na during COVID, naka-quarantine tayo.
Her boss is right. Vaccine coverage rates, or VCRs, did drop during the pandemic due to the lockdown. But as the Philippines opened up again post-pandemic, VCRs returned to around 71% as early as 2022. Now the immunization program faces another problem: issues in supply. The DOH expects to run into a shortage of DTP vaccines in May.
And ito yung ina-address namin gap. So baka mag-order ako ng another type, yung old vaccine, yung DPT, diphtheria, tetanus, pertussis, yung tatlo lang. Kasi yung pentavalent, alam mo kasi niya ang vaccine pag in-order mo, tsaka pa lang nila i-manufacture yan.
Yes.
Tapos may lag time yan. So we ordered the doses for this year. Parang early this year, may 120 days. June pa siya dadating.
So even if mothers did want to have their children vaccinated, their local health centers may not have stocks of the vaccine. Without these vaccines, children are not only vulnerable to the whooping cough, but to other diseases covered in these 3-in-1 or 5-in-1 vaccines, such as tetanus and diphtheria. So why the supply issues? The PIDS found that the DOH has recently attempted to procure vaccines directly from manufacturers, which is competitive in nature. But since these bids often fail, the DOH often resorts to emergency procurement with UNICEF, which is supposed to be requested in the third quarter of the previous year. The last-minute requests and often late payments don't exactly present the Philippines as a responsible customer. In the case for DTP vaccines, the DOH only gave the winning bidder a notice to proceed on March 27, 6 days after Quezon City declared a local pertussis outbreak, and 2 weeks after the bidder was awarded the contract for procurement.
So may parang short gap ako. So ang hirap din mag-recommend na pabakuna kayo, tapos magagalit sila sa akin, hindi pa dumating doon sa health center.
Okay.
So meron tayong ibang recommendation, antibiotic. Merong antibiotic para gamutin. So early detection, parang PDITR, prevention. Pagka merong nag-whooping cough na bata sa pamilya, i-isolate mo na yung mga kapatid.
So what can the Philippines do to stop the rise in whooping cough cases and prevent the return of vaccine-preventable diseases? Former Undersecretary Tayag has an idea.
Ito mga kailangan dyan. Una, sapat yung supply ng bakuna. Ang mga pamalang lokal ay may kanya-kanyang plano para siguraduhin na walang maiiwang bata o baby na hindi mababakunahan. At pangatlo, hindi kami mahirapang magkumbinsi kung bakit kailangang mabakunahan si baby. At pangapat naman, ang tulong-tulong hindi lamang ng Department of Health, international organizations, lahat na para na sa ganon ay magawa natin ang ating gustong mangyari, 95% fully immunized child coverage.
Boosting the country's immunity against pertussis and other vaccine-preventable diseases is a multi-sectoral effort requiring the full investment and cooperation of the government, the private sector, healthcare workers, and the public. But at the end of the day, these will create a strong, robust healthcare system, one that will hopefully make vaccine-preventable diseases such as the whooping cough a distant memory. And that was today's episode of Teka Teka News. This episode was written by Tatiana Maligro and voiced by me, Bella Perez Rubio. It was edited by Pedoy Blanco and executive produced by Jill Caro. Our senior news editor is Veronica Uy. If you like this episode, share it with a friend or two. And of course, don't forget to follow Teka Teka News and Puma Podcast on your favorite podcast app on YouTube. Thanks for listening.